Assalamu alaikum wa rahmatullahi wa barakatuh. I am Bilal Abdul Kareem for On the Ground News, and we are coming to you from northern Syria. In recent days, there has been a severe uptick in terms of airstrikes which have been landing in the different cities and the reef areas, or I should say the countryside areas, here in northern Syria. Now, we're going to be discussing the medical situation in these territories, and there's no one better to do that with than with the medical professionals which are on the ground dealing with the issue. So I'd like to begin with Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
What is your name? And where are you from?
My name is Dr. Shajul Islam. I'm from England in the UK.
Okay, let's begin firstly with medically. What's the situation like in the Syrian territories these days?
In the last week alone, in the city of Idlib, to use as an example, which is a city of the size of about 2-mile radius, we had about 31 airstrikes. Each airstrike producing on average 10 to 15 severe casualties. This is what we're dealing with. On top of that, the main hospital in the city of Idlib was hit and taken out of action. One of the only hospitals with an intensive care unit and a CT scan facility. So we are facing major difficulties in treating patients, and the facilities that we have for treating these patients, this increase in patients is being taken out. Let me break it down to you. We're getting serious trauma patients, for example, head injuries, which require CT scan and neurologist, who we would normally send to the hospital in the city of Idlib. Now that hospital is out of action, and we are having to turn these patients away and tell them to travel another hour in very dangerous circumstances with severely ill patients to find the nearest facility that could cater for them.
So you're saying that if someone comes to your hospital as the result of an airstrike and they have a head injury, just to paint the picture for the people there so that you understand, blood, not responsive, things of this nature, you're saying that when you send them to the Idlib hospital, it's an additional hour for them to get medical treatment?
That's right. The Idlib hospital has been taken out of action. It was hit by an airstrike. And because of that, and that was one of the main hospitals that used to cater for these serious cases, which had an intensive care unit, and now we are having to send them an hour further in very dangerous circumstances.
Now, I want to ask you about yourself personally for a moment, just kind of step away from the questioning, because it's relevant. Why did you come to Syria?
Look, I'm a doctor. There's a serious shortage of doctors here. And anyone listening to this that is a doctor needs to be here. And I don't understand why they're sitting in Europe or sitting in England or America. We need doctors here. We have casualties you cannot imagine. You cannot imagine the number of casualties, the increase in the number of casualties, for example, in the last few weeks is crazy. And we just don't have enough staff to cater for them or facilities.
Finally, what do you think people need to know about what's been going on inside of the Syrian territories? Because just as you made mention that there's a severe shortage in terms of medical professionals, there's a severe shortage in terms of journalists here. So what do you think that people outside need to know about the crisis here that you think they don't know?
Look, I'm going to give it to you from my perspective. Okay, I'm seeing the casualties from the airstrikes. And I'm telling you that 80% of the casualties are women and children. The airstrikes are not hitting terrorists, they're hitting normal civilians. Imagine this, you are sleeping at home with your family and an airstrike hits your house directly. Well, this is happening to a lot of families. We're getting whole families being wiped out while they're sleeping. Buildings, these are solid buildings, crushing them to death. And so we are seeing on a daily basis 10, 20, 30 people being killed by these airstrikes. I want you to picture this. I want you to picture your family, your loved one, your wife being killed, and multiply that maybe your cousins, maybe the last wedding you went to. Hundreds of people being killed. Well, you can't picture it, but I'm seeing it. And I'm telling you, it's a fact that they are killing civilians. The Syrian government, the Russians, and any other government that is working with them are aiding in killing civilians here, the innocent civilians of Syria.
And I know I said that was the final question, but I'm going to just take it one step further. For yourself personally, for your colleagues that work alongside you, some of them are Syrian, some of them maybe from other countries, is there an emotional toll that seeing this type of trauma on a daily basis, is there an emotional toll for it?
Of course. I mean, we are human beings, and it is very difficult for us to deal with. But we have no choice, because we are very limited in the number of staff we have, and we have to be functional. We have to be functional 24/7. It's not a shift thing that we have here. We stay in the hospital. Like, okay, I might do 4 days, 5 days. These 4 or 5 days, 24 hours, I'm in the hospital. And I have to be ready to respond to patients anytime the airstrike lands.
Have you had patients that when they came in and you looked at them and you felt, there's nothing I can do for this patient?
All the time. All the time.
I am Bilal Abdul Kareem for On the Ground News. Assalamu alaikum wa rahmatullahi wa barakatuh.